Hi guys, it's Karen from Beyond IVF Baby channel. I'm so glad you're here. Well, after more than 9 years on the journey, I want to tell you some of the different treatments I've tried, and I'm going to give you the hits, the misses, and those that are to be determined. With many of these treatments, it's probably for your best to take it with a grain of salt. And if you were like me, didn't know what was going to work for you, you have to really kind of dive in, try things, and you decide if it's something that is going to be worthwhile to kind of incorporate into your life, or if it's something that you want to say next and try something different. Okay, so with that being said, let's dive into my list. This is going to be a part 1 of 2, or maybe a part 1 of 3. Who knows? So let's get started. One of the first things to talk about would be acupuncture. This is something that's not super expensive. Sometimes your insurance will pay, and you can find fertility specialty acupuncturists. So these are acupuncturists with additional training. On top of that, there's something called LLLT. This is something that may or may not have taken off, but basically the thought is, even in older postmenopausal women, it was found that if LLT laser was, goes over the ovaries, that there is the potential to reactivate your period and ovulate. So I don't think that helps everyone, or maybe it depends on how many treatments, the skills of the practitioner, and all those things. But for me, I'm going to say it's a miss. I don't think it did anything for me. Something that you may also want to inquire with your acupuncturist is Chinese herbs, because anything you do with Eastern medicine, you don't necessarily have to do IVF, or certain things your IVF doctor will want you to stop. For instance, acupuncture is fine, all the other treatments like LLT. However, the Chinese herb remedies, this is something that can't be predicted, and most of your reproductive endocrinologist or RIs will not want you to be on those treatments during an active cycle where you're on all those fertility drugs at the same time. Okay, so that's something that you might want to consider. Some women will get pregnant just doing acupuncture alone. Some women will get pregnant just doing acupuncture and herbs alone. And then you might want to research and look into things like ozone therapy as well as LLT therapy. You'll even find it being offered of some of the fertility clinics. I know one in New York, for instance, that does ozone therapy. It's mostly Asian, Asian predominant, I would say, clinic, but anyone is welcome for treatment there. So that's the acupuncture bit. Another thing you might want to ask your acupuncturist is if they do ear seeds. Ear seeds is something just like it sounds. It's little seeds that are not pierced in your ear, but they are like massaged into your ear. A tiny needle, so not a piercing, will go in certain key areas first, kind of like acupuncture is, and you will massage those ear seeds for a period of time before they fall out. You'll have, different amounts on the right versus the left ear that correspond to fertility junctures. So that's, again, something relatively cheap. I'm not saying it necessarily helped, but it was fun and inexpensive, so I felt it was worth a shot. Another thing to look into, and this is the last thing I'm going to talk about on this list, is going to be PRP. Why? Because it is something that I think is helpful. However, you have to take that with a grain of salt, because while one treatment, which is new and not proven, might be helpful for some, it won't be helpful for everyone. Some people might find bad consequences. I have Remember women saying on different forums that their period disappeared, and has anybody else experienced that? So it's something to certainly ask about. But what I will say, now that the price has come down in the United States, for instance, I got all but one of my PR treatments in Europe because it was only the equivalent of about $1,000. But now you can find the nearest CNY fertility clinic near you, and you can get the treatment for about $1,000. So the price may have gone up somewhat. I know when I had it, it was, about probably going on close to 3 years now because my daughter's not yet 2. But this is why I'm going to say this is a win and it's worthwhile to explore. One, the price has come down. There's a clinic in the United States that offers it. They have many different locations. So you could probably get a cheap flight to one of those locations. Luckily, there is one in my state, so I can simply, plan a day to drive there because it is a bit of a distance. Okay, why I like PRP. And let me qualify that, because PRP is not just used on the ovaries. It is used on, you've heard of probably the PRP facial. So it's touted to help reduce wrinkles. Most people I know disagree. I have tried it. I have friends much, much younger than me in their early 30s. No, doesn't seem to be impactful. You've heard it for the hair, for hair loss. Again, I don't know if it's any better than, say, laser or hair vitamin. So it's not something I have tried. So maybe it's helpful, maybe it's not. But I'm going to talk about PRP in the sense of what it may or may not be able to do for your ovaries and for your health. So let me explain. PRP, when I had my most recent treatment in which I was able to get pregnant, stay pregnant, and have my baby, we did uterine PRP at CNY in Sarasota. So here, they're taking for me, in my case, it was 2 tubes of blood almost, because my vein decided to shut down and stop. So we had to go to the other arm. So they basically separate your platelets from your blood, and it's not the blood, but the platelets that are going to be injected. So basically, since they're not going into your ovaries, they don't knock you out. So there's a little bit of pressure, but it's tolerable. Whereas typically with ovarian PRP, they're going to knock you out. And this also is probably why it's a bit cheaper compared to other clinics in the US that offer it. Their prices are still relatively high because they're knocking you out, they're giving you anesthesia. So with ovarian PRP, I think honestly this might be even better than the very targeted ovarian PRP. Why? Because eventually, as it's going in your uterus, it's going to go all over. It's going to bathe your fallopian tube, it's going to go to your ovaries, it's going everywhere. So this is the second reason I would continue to do PRP even if I wasn't going to have another baby. It's for your overall well-being. So I'm talking about in the bedroom. I'm not sure exactly what I can say on YouTube, but you may have heard something called the O shot. You can Google that if you don't know what I'm talking about. So basically, it should not be any shock as you get older, and ladies who are typically in the over 35 range, you're going to have performance difficulties in the bedroom. So it's going to become more of a struggle for most women, and they're going to experience other effects like dryness, maybe pain, maybe irritation, all these other things that are just going to start to crop up because your estrogen is starting to decline. So with PRP, remember PRP is something that helps reduce inflammation in the body, and also as you get older, the more inflammation you have. So less inflammation is good. Less inflammation is going to be conducive to getting and staying pregnant. So with the PRP shot, again, quite expensive. It's kind of like doing the ovarian PRP in the US. It's going to be a couple $1,000s, and it doesn't last that long from what I understand. So it's something you have to like keep on doing over and over again. However, I noticed the benefit with either the ovarian PRP or uterine PRP, you get the same impact you're probably getting with that O shot. As in, it's turning black, it's turning back the clock, and things are going to be really easy for you in the bedroom. Now, this may not be everybody's experience, and you are welcome to let me know and share your thoughts if you think about it, if you had the ovarian PRP or uterine PRP, or even if you had the O shot. Do you notice a similar benefit in terms of how things go in the bedroom area? But bringing you back to the fertility reason, I would do PRP. I would pick CNY because it's an affordable fertility clinic. You'll probably find one that's not too far from you, hopefully, or just a quick plane ride away. And I think it's something that isn't so expensive if you don't have a fertility benefit at work, that it's something that you can weigh the pros and cons to trying before going into a full-fledged IVF cycle, or it's something that you may wish to do like I did. You're using the PRP to complement your IVF cycle because you want to reduce the inflammation as much as possible to help encourage implantation and having your embryo stick. So since the holidays are coming up, I wanted to give you some different treatments to consider apart from IVF, things that you might want to ask your RE, things that you might want to research or inquire with other women on the forums that you belong to, because I think it is something that you definitely want to look into. With that, until next time, I hope your journey is going to be a success. Know that there is hope for you. I am encouraging you to keep on going, to find your chosen path to motherhood. And until next time, I will have more for you later. Ciao.